and Brad, the two most famous physical therapists on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
And
therapist.
together we are the most famous physical therapists on the internet.
In our opinion, of course.
Lonnie's gotten problems over there. Today, Brad, we're going to talk what I think both agree wholeheartedly is the best self-treatment book for neck and arm pain.
Right, absolutely.
And this is by Mackenzie, or herniated disc also.
Right.
In the cervical spine, right?
In the neck.
Yeah, I mean, hands down, we are not being paid by him. We just have been fans our whole lives, our whole careers, I should say.
I was just watching a video that he did when he was still alive, and they were videoing him about some of his treatment in his past life, and then he actually treats the cameraman. So
oh, really?
Video, yeah, because he's having neck problems because his head's forward in this camera while he's shooting the camera, and they show, well, we might as well show it, and the guy feels better than he has in a long time after just one treatment by the master.
Amazing man, without a doubt, the most influential and famous physical therapist to be on in the world.
Oh, right. He's got so many credentials, and he's won so many awards worldwide for his work. He was born in 1931. He died in 2013. In his work, so will go on forever. I'm sure. There's one thing, the book is right here, as a matter of fact. And if
it's a real thin book it's more of a
it's made for the layperson.
Right.
It's not made for although the therapist can certainly get information out of it. It's a good thing, but you can read it without going into a lot of anatomy and terms that are complicated. It's written for anyone.
You want to read the title, Brad, so we got it exactly?
Treat Your Own Neck. So
by Robin Mackenzie.
Right. And he's got some nice testimonials on the back. Here's a short one by, I won't say her name in case you wouldn't want me to, but it says, "Your technique has been incredible for me. Previous to learning the Mackenzie exercises, a neurologist said that the disc compression in my neck might need surgery and nothing would help. He was wrong."
Yeah. So generally what you're going to see with this, Brad, is quite often you're looking at pain patterns. Where this really tends to help is you're going to have pain, obviously, in the neck.
Right.
But a lot of times you might have it between the shoulder blades, on the shoulder blade itself, and then it can also travel down the arm, right, Brad? Down the back of the arm.
And you can see we got Gumby here in the way. I'll move him a little bit. But this red tubing here, it just represents how the nerve path goes from the low neck. And usually with neck pain in this area is in the low neck. It's not in the upper neck. The low neck is common to refer here down the arm, and it follows the nerve path all the way down into the fingers, right to the fingertips. And if you've got this problem, you know exactly what we're talking about.
And if it is upper neck, you might be getting it up into the head, and he even covers that too in the book.
Exactly.
So,
you bet.
So.
All right, let's get Gumby back in there. Okay. So we've done a number of videos on this, Bob, and we're showing the techniques, but if you're like a lot of people, you can watch videos, but when you take a book out and you read the written word, it seems to sink into your head. Your mind assimilates it better. You remember it better. It's just another way to improve your ability to treat yourself.
Well, you can go at your own speed then, too, while you're reading it. As opposed to the video where it's kind of things are moving calm.
And they're watching us, and that's not good for anybody either, That was a joke, Bob.
I got it. By the way, if you are new to our channel, please take a second just to subscribe. Our subscribe button is right over here on the left somewhere. We provide videos on to stay healthy, fit, pain-free, and we upload every day.
Excellent.
All right, Brad, what's next?
Okay, common neck problems. Oftentimes we talked about the location of the pain in the back neck. Usually it doesn't refer to the front of the shoulder. It can, but most of the time in the back. And oftentimes, and Mackenzie will say this, majority of the time it's from posture. You may have fallen, or you may have done something to jerk your neck, and you think, oh, that's where the problem came from, because I almost fell, or you bumped into something and jerked your body. But probably over the number of years.
Yeah, these are problems that are created over time.
Right. Here, let me. And this is good if you're sitting on like bleachers or something without a backrest. Oftentimes your posture goes into this. We get the head forward posture, and it really puts a lot of stress on the back. And Bob, do you want to grab the spine for a second? And he talks about posture with the low back, and then they talk about slumping your low back forward, put stress on your low back, creating back pain. However, head forward posture does the exact same thing to the low neck. Maybe not the exact same, but the principle's the
Right.
same. So if we look at the neck, this would be the head here, and here we got C1 through C7, the vertebrae on top with the discs in between. Here we got good posture, and there's usually a little curve in there, and that's good. But when you bring your head forward, you can see right between my fingers here. Should I get a little closer, Lonnie? Head forward posture. Yep, does this, and you can see it stressing right in here, and it stresses those discs, possibly causing herniation and pinched nerve. At that point, you get the symptoms of pain and numbness, the tingling in the shoulder, down in the hand, all the way to the fingers. So we need to reverse that. We need to do it properly, and the technique that we're going to show you is it's a system. How we start out, and it'll progress.
Yeah, he takes you right through step by step what you need to do in the book, and he'll tell you if this, you try this, and if it doesn't work, then you try this.
Right.
Basically, so it's just laid out perfectly. I mean,
Because, like with Bob and I, we've been doing the system for years. With a patient, sometimes we skip some of the steps in the book.
Yes, we do.
Because of our experience.
right, we see where they can go.
Right, so we can take some shortcuts, and we can get to get the end result a little bit faster.
Right.
But go through the book, and this will work out well. So what we're showing may not follow exactly to the book.
Right.
But the concepts are there. One of the first things he talks about is chin tucks
Yeah.
and posture.
Yeah,
So
that's always the starting point, isn't
Right,
it, Brad?
yeah.
So
if I'm sitting here, and a lot of times people come in, you ever have this happen, Bob? They're a patient, they'll come in, and they're like this. I've got this neck pain, and it's hurting here, and it's going down my arm. And then I'll have them sit up like this and start to get straight, and they say, oh, that's really weird. They don't experience
Right.
this. They're kind of locked up in this. So then we get them to sit up straight, and then add the chin tuck.
Yeah.
You can't chin tuck when you're slouched. You must be straight first and get that chin tuck going.
So the chin tuck does two things. One, it puts you in the right posture.
Right.
But two, it starts getting some movement in the spine. Which is
Exactly.
what you're needing, because movement actually helps help things heal, actually.
Exactly.
You get more blood flow to the area.
And if you're lucky, sometimes just the chin tuck can start to release pressure on the nerve, taking symptoms out of the arm. That's a nice
I've
situation.
had the last person I just treated, Brad, that had this. We did the chin tucks, and I'd hoped to start going into extensions.
Yep.
It just fired things up. I mean, she had to do chin tucks for a whole week.
Oh,
before
really?
I could, yeah,
Yep.
that's
Yep.
all she could
Right.
tolerate. She was one of those very difficult cases.
And you want to lay down, Bob?
Sure.
And sometimes a chin tuck in the seated position won't produce results, but if you lay down, and usually...
Don't we have a towel too? Well, sometimes you put a towel underneath the head like this, a rolled towel, and it helps you kind of create the...
Oh, yeah, Bob, we got a towel right here in our toolbox. And Bob straightened the cupboard door. by
Yeah,
the way.
people were worried about that, so...
So you can put a towel right here, Bob?
Yep. Yeah, exactly. Now it's a lot easier to chin tuck.
Sure, you get that space there. And you're going to chin tuck gently, and if it feels good, if you're getting symptoms away from the arm and the hand, perfect. That's exactly what you want to do. And you do about 10 of them at a time, and then that's enough. Give it a break. You don't want to do it, if you think 10 is good, you're going to do 30. That's not the idea.
And you can do it every hour.
Sure,
I mean,
exactly.
That's
Right.
the whole thing about these. He wants you to do these a lot.
Right.
I mean, so...
And the whole concept is that if you've been sitting like this for the last 10 years and your neck it's really bound up and caused some contractures, it takes some time to stretch that out. You're not going to do it all in one sitting.
So usually the next step then is to try to do some cervical extensions, right, Brad?
You bet. And for this, a chair with a backrest. And I like to have my backrest in the clinic always, well, Bob's pretty tall.
Yeah.
But it should go right around the shoulder blades. If it's a chair that comes up to here and why don't you bring your head back, Bob? And your head would hit it, that's not good. You need to have something lower, and it's nice to be down in the mid-thoracic back.
So you start off with the chin tucks, and then you're going to work on going back. And some people can only go back a little ways before it starts sending pain down their arm.
Right.
So I might only have them go this far to start off with, Brad.
One of the analogies I had at one of my Mackenzie classes is like a nutcracker. And you're going back like that, and it's like you're pinching things, and you have to stop. And people are like, oh, no, I'm not doing that.
But over time, and again, doing these every hour, eventually you're going to start to get back further and further.
Yeah. And one little trick that I find helps a lot is I take a towel roll. I do this a little bit differently than Bob. But if you can just get a towel roll
You
here.
go down like this, don't you?
Yeah. And then go back. I'll do the other one to it. It all depends on the patient. We're just talking about our
Yeah, there's
little-
different techniques that we use.
But some support there can really make
This
a big
helps a
difference.
lot.
Right.
Yeah, I've had a lot of people that have had
Because
good luck
sometimes
with
they
this.
can get back by bringing the head up. Oh, that hurt's coming up, but with the towel roll there, it becomes very easy.
But with or without the towel, again, the goal is to get way, way back.
Right. Exactly.
I mean, you're going to be shocked at how far back your neck can go if you really work at
Right.
it.
And I don't know where this comes from, but I've seen this in a lot of fitness studios and in gym class at school. I've heard it's bad to look back with your neck. It's going to hurt your neck.
Everybody thinks that, and that's the exact opposite. And that's why it was so controversial when he first came out with this practice.
Right.
Is because everybody was telling you this is bad for your neck.
Right. There's one exception. If you go back like this and it gets you dizzy or it causes any kind of headaches, then you must stop.
Or if again, if it's increasing the arm pain, you want to back off.
Right. You're not ready for it yet.
So basically, we just kind of touched upon this because there's a lot more steps to go through this,
Right.
but we think it's worthwhile. We'll put, again, the name of the book down below here so you can take a look at it.
Right.
And
the nice thing is about when it's done, he talks about maintenance exercises. After your things are taken care of, what do you do to keep it so it doesn't come back and you don't get the problem?
So I think you can go on to Amazon, or OPTP sells this too.
Right, yep. So, wonderful book. So take care of your neck and be careful.
Thanks a lot.